After World War II, England wanted to show that it was a welfare state. In 1948, it made a promise to its people. When this promise was first heard, it seemed almost impossible to everyone. In England, no one would be denied healthcare because they could not afford it. Whether poor, elderly, or unemployed, everyone would be able to benefit from the healthcare system. The institution that embodied this promise was called the National Health Service. Free, universal, and public. At that time, this was a system rarely seen anywhere else in the world. With this system called the NHS, the British government provided the advantage of equal access to everyone. Major surgeries were free, and healthcare expenses did not lead to personal bankruptcy, which was a significant distinction from the American healthcare system. So, how does this NHS work? We can evaluate the system based on three main steps. First, the general practitioner. Second, specialist referrer. Third, hospital and advanced treatment centers. In other words, as in many countries, in England, you cannot go directly to the hospital when you're sick. You first visit the general practitioner who then directs you to the appropriate hospital. And then the question is how this free, universal and publicly accessible system managed to stand on its own. How is the financing of this system ensured? The NHS is largely funded by general taxes and national insurance contributions. In England, citizens do not pay to visit the doctor. Hospital surgeries are free. Emergency services are completely free. However, prescriptions have fixed fee. Some dental and eye care services are also charged. When it first established, the system was so good and worked so well that no one could believe it. But today, it is sounding the alarm. The NHS has been facing serious problems in recent years. Long waiting times, especially surgeries that needed to be done urgently, with waiting lists lasting for months, are one of the clearest signs that the system is failing somewhere. Staff shortages, financial pressure, and overcrowding in emergency service are other issues signaling the system's distress. Especially after the pandemic in 2020, waiting lists reached record levels. Let's take a detailed look together at the funding of the NHS, its early days, the problem it faces today, and its pros and cons compared to the health system of the United States, which is always a topic of debate. The National Health System is the public health system of the United Kingdom. It was established in 1948, and its founding principle, as explained by its founder Aaron Bevan, was healthcare is providing according to need, not able to pay. The NHS is not only England's health system, but also its largest public institution and employer. It is impossible to understand the current crisis in the English health system without understanding this system. Because the NHS is not just a health system, it is a symbol of the English welfare state. How did this system, which worked wonderfully and was loved by the entire society when it was founded, start to deteriorate over the years after initial functioning well and now raise alarms? There are multiple reasons for this. One of these reasons is England's aging population. The population over 65 in England is rapidly increasing. The rate of chronic illness is rising. An aging population means more expensive healthcare. When the NHS model was designed in 1948, the demographics of that period were different from today. A country that emerged victorious from World War II had a lower proportion of people aged 65 and over compared to today. Life expectancy was significantly lower than it is now. This system, designed for England in 1948, has seen many different governments up to the present day. Although some changes have occurred, over the years the system began to fail to keep up with the society it belongs to. Between 1948 and 2026, the population of England increased from around 50 million to about 70 million. One of the current problems NHS faces is the staffing crisis and strikes. The shortage of nurses and doctors is expressed in thousands of thousands. Large strikes have taken place in recent years. Real wages have eroded against inflation. This situation directly affects the quality of service. The inability of a number of nurses and doctors to keep pace with the growing population has greatly extended waiting times in hospitals. Another problem NHS faces is the explosion of waiting lists. Even before the pandemic in 2020, waiting lists were already causing difficulties for the British, and after the pandemic, millions of surgeries were postponed. In some specialties, waiting times can reach months, even up to a year. Waiting for hours in emergency departments has become normal. The funding model that keeps NHS afloat has gradually become insufficient to adequately support the system. NHS is a system financed by taxes. But the problem is this: healthcare expenditures increase every year, but tax revenues do not increase at the same rate. This creates constant budget pressure on the system. Budget difficulties in the financial system immediately show their negative effects on the system. Many problems in hospitals stem from equipment shortages and the inability to replace outdated equipment. The extension of doctors' and nurses' working hours, the decline in the quality of the working environment, and parallel to this, salaries being crushed under the inflation led the doctors and nurses working in the system to complain about it. Especially after Brexit, the reduction in the flow of personnel from the European Union and the limited capacity for the education in the country are making the system even more difficult. Another serious problem in the NHS has faced over the years is structural inefficiency. There's too much bureaucracy within the NHS. Digitalization in the system is very slow. The management structure is very complex and reforms carry political risks. Therefore, even the system wants to implement reforms, it cannot, but the burden continues to increase. This can lead the system into tragicomic situations. You can have heart surgery in England and not pay a single penny for it. Sounds great, doesn't it? But you may have to wait for months to get the surgery. Free, but very late. More than 7 million people in England are waiting for treatment. That's roughly 1 in every 10 people. It's a very clear fact that the NHS cannot meet the public's demands. Even though the system wants to renew itself and respond to public's needs, it's not an easy matter, because the NHS is not just a healthcare system. It is also a political issue. The NHS is one of the most powerful institutions at the heart of the British politics. The NHS was established by the Labour Party government. From 1948 to 2026, many different parties have come to power in England. The NHS has been a central topic in political campaigns during the election periods in England. During the elections in England, the question is always asked, who can be trusted on the NHS? This alone shows how political the system is. There are several different perspectives on the NHS between the Labour Party and Conservative Party. These differences in viewpoints have changed and transformed the structure of the NHS over the years. Since the NHS budget is directly determined by the government, the perspective of the party in power has a strong impact on the NHS. Although the NHS provides many services free of charge, it is not entirely a state hospital. Some services are provided by private companies. However, the funding is public. This always makes the NHS one of the main issues in elections. The NHS is a very powerful election tool. It is impossible to generate fear or hope through the NHS. For this reason, every crisis topic quickly turns into a political debate. So let's take a look at the NHS, which is currently the focus of the debates in Britain, and compared with the American health system, which has always been subject of discussion. The American and British health systems are fundamentally different from each other. The British health system is tax-based, while the American health system is insurance-based. In the UK, everyone is automatically included in the system. In the US, access to healthcare depends on the type of insurance. America has one of the highest per capita health expenditures in the world. The UK, on the other hand, spent much less per capita compared to the US. Despite this, American health system faces a lot of criticism. In other words, the US spends more, but this does not always yield better results. The American health system provides quick access for this with good insurance, while there are some serious barriers for the underinsured. In the UK, since everyone is covered by the system, there can be waiting times even for specialist appointments. Waiting time and financial risk are the most critical differences between the American and British health systems. The British health system has a lot of rate of quick access, but no financial risks. The American health system allows quick access, but has high financial risk. Looking at the outcomes of these systems, the UK is better in life expectancy, and the overall infant mortality rate is also lower. The English healthcare system is also more advantageous in preventable death rates. While the American healthcare system lags behind in these parameters, it is very strong in some advanced technologies and cancer treatments. Another area where these two systems differ is administrative structure. The NHS consists of a single system and offers less billing complexity. This results in lower administrative costs. The American healthcare system, on the other hand, consists of many insurance companies. Therefore, it is a complex billing system. A significant portion of healthcare system in the US goes to administrative costs. After reviewing this data, the political and ideological differences between the systems immediately stand out. While the NHS views health as a social right, the American healthcare system sees health as a market-based service. This is not just an economic difference but a cultural one. Neither system operates flawlessly. They inevitably experience crises. The types of crises they face are, of course, different from each other. The NHS experiences crises in waiting times, staff shortages, and capacity pressures, whereas the American healthcare system faces crises in high cost, insurance inequality, and medical debt. When looking at both systems, deciding which one is better can vary depending on individuals' priorities. Those who prioritize financial security may prefer the NHS, while those who value quick access might choose the American healthcare system. The difference between the NHS and the US healthcare system is not just about money. It is about what society believes healthcare should be. Returning to the NHS, can the English health system overcome the issues of increasing waiting times, staff shortages, and capacity pressures? Although the NHS budget increases every year, this budget increase does not stop the crisis. So, does this mean the NHS has collapsed? Collapse implies a sudden failure. Hospitals are still functioning. Surgeries continue. The system tough strain continues. But something quieter may be happening. The system is approaching its limits more each year. It is gradually deteriorating. The NHS does not collapse overnight. However, it may be undergoing a long-term sustainability test. The NHS represents not just a health system for England. It also represents a philosophy, a commitment. Healthcare in England is a right, not a privilege. But rights also require resources and compliance. They need political will. The real question is whether a model designed in 1948, like the NHS, will develop quickly enough for 2026. Because if the NHS changes, England changes with it.